Thank you, Taylor. My name is Lauren Davis, and I'm an attorney at Community Legal Services, joined today by Maripat Pileggi, also attorney at Community Legal Services. And today we're going to get into some of the big changes coming up to the medical assistance or MA program for immigrant groups under HR 1. Next slide, Taylor. Before we get into the substantive part of our presentation, just some background about Community Legal Services in case you're not familiar with us. CLS provides free legal civil services to low-income Philadelphians. We have 7 or 8 legal units that cover a wide range of legal issues, including public benefits, but also a lot of other topics like utilities, landlord-tenant issues, homeownership issues, employment, child welfare for representation of parents. So there are a wide range of things we might be able to help with. For new clients who need help with medical assistance, though, you should refer them to an intake for CLS if you're in the Philadelphia area. We have both in-person intake and phone intake available. We have in-person intake available on Tuesdays and Thursdays at our office in North Philadelphia at Broad and Erie. And then we have phone intake available on Mondays and Wednesdays from 9 a.m. to 12 p.m. If your client calls in the morning and leaves a voicemail, someone will call them back that same day, probably within that same morning. We have language access services available for all of our intake streams. And then if you have a client who needs help with medical assistance who is not in Philadelphia, we have a link here in the slides that will be shared after this presentation so that they can find legal help close to their area. Next slide. So this is just a roadmap of what we're planning to discuss today. We'll start with some basic immigration terms to sort of ground our conversation for today. Then we'll go over medical assistance eligibility in general, and then we'll narrow down to immigrant eligibility for medical assistance, and then we'll move to the primary topic, which is what are the changes exactly coming down the road with HR 1 starting October 1st. And then if we have time, we'll do a live Q&A. But as Taylor stated, any questions that we don't get to in the chat or through the live Q&A, we'll follow up with after the webinar. Next slide. So just starting with some basic immigration terms. So we're just going to go over some of the groups that we see most often here at CLS and that you might be seeing in your work as well, just to get an understanding of where everything is coming from. So starting with refugees and asylees, these are two similar groups who have a humanitarian immigration status. Both refugees and asylees leave their country because they fear for their own life or safety or that of their family, or when their government will not or cannot protect them from serious human rights abuses. The primary difference between these two groups is that refugees, they'll enter the United States with their status already set. Asylum seekers, they will get their asylee status once they file their claim in the US and it's accepted. So someone could be in an asylum seeking period for quite a bit of time before their claim is accepted formally by the United States government, but otherwise they're very similar. Next slide. Cuban Haitian entrants, they're a group that we see pretty frequently here in Philadelphia. Cuban Haitian entrants will be very important for our later discussion of the upcoming changes to HR 1 and which groups will remain eligible for medical assistance benefits. This group consists of citizens of Cuba or Haiti who present themselves at the U.S. border and are then paroled into or have applied for asylum into the United States and do not have an enforceable deportation order. I've seen that most of my clients who are Cuban or Haitian fall into this group. To determine that for yourself when you're talking to someone, you just might want to ask them additional questions, like did they present themselves, what paperwork they have to really narrow down here. Sometimes the welfare office may not realize someone is a Cuban Haitian entrant, and so you might need more information to advocate for your client here. And we'll also later on in the presentation get into some more screening questions that you might be able to ask to really find out if someone falls into this category. Another group that's really important for this discussion is COFA migrants. We don't really, that we're aware of, see a lot of this group here in Pennsylvania, but it's very important for the changes coming up to the medical assistance program. COFA migrants are citizens of Micronesia, Palau, and the Marshall Islands who have a compact with the United States to fall into this immigrant group. And then the last group that we have here are VAWA self-petitioners. These are battered spouses, children, and parents of U.S. citizens or green card holders who apply for their status through VAWA or the Violence Against Women Act. Next slide. Okay, a few more groups that come up frequently in our work. Parolees. These are persons who are granted temporary permission to enter the United States, often for humanitarian reasons. So this could cover a wide range of countries, depending on the person. And then we also have U visas, which are for victims of certain crimes in the United States who cooperate with law enforcement and then get a path to a visa through that cooperation. Then we have temporary protected status. This category can be a bit tricky because which countries are covered under this status can change depending on designation by the federal government. You may have seen that in the news frequently that this can shift around a bit, which countries are covered here. So if you have a client who you think falls under this group, you might just want to either check in with Immigration Legal Services or do a little bit of digging to see if they're a group that is still covered under this group. But generally, this is for people from countries that have been designated as dangerous for some period of time that's decided by the federal government. And then we have undocumented immigrants, and this term is for anyone who either entered the U.S. without inspection or a legal status, or they may have entered in with a legal status originally, but it's now expired. And again, these are just some of the groups. There are many different categories of immigrant groups, but these are some of the ones that we see most frequently. Next slide. Okay. So lawfully present. This is an immigration term that is not really a status per se, but is a term that comes up for benefits purposes and is important to ground our discussion. So this really applies to like a broad range of different statuses that allow immigrants to be in the United States with permission and covers all of the groups that we just discussed. For federal benefits purposes, it covers all of the groups we just discussed, with the exception of undocumented immigrants. It also includes some groups that we did not highlight, such as those with work authorization, green card applicants, and most other immigrants with a work authorization. So again, this is not a status someone would come to you and say, like, I'm lawfully present. This is just a term that might come up when you're in conversation with the welfare office or policymakers to describe a larger umbrella term for immigrants who are legally here in the United States. Okay. Lawful permanent residents or green card holders are non-citizens who have been granted authorization to live and work in the United States on a permanent basis. These people can be eligible for green cards or their LPR status through a family or employment relations. Many humanitarian immigrants, such as refugees or asylees, have green card eligibility, and many of them do have green cards. When someone is in this status, they are given a permanent resident card, which is also called a green card. So that's sort of a quick identifier for someone in this group. You can just ask them, like, do you have a green card? And you can take a look, and that will give you a good indication of what benefits that person may be eligible for. There are a few groups that are eligible for green cards. Those include refugees, like I already stated, asylees, special immigrant visa holders from Iraq or Afghanistan, which are people who have helped the United States during conflicts in those countries, in Iraq and Afghanistan, and have a path to a visa through that cooperation or assistance. And then we also have U visa holders, which we already covered, and then T visa holders who have been victims of trafficking and have a path to a visa through that experience. Next slide. So these are some questions that can help you identify what your client's status may be. Some people are very aware of what their status is, or they have their paperwork with them, and you can easily figure it out by looking at whatever they bring into your office. But some people are really not sure, or maybe their status has changed over time, or they had valid status and it's expired. So these are some questions that can help guide you in trying to figure out what status a person might have and what they might be eligible for. The most straightforward being, what is your immigration status? If they're able to answer, you could stop there. But if they're not sure, you can ask them, like, did they come to the border? How did they come to the border? Did they have a family member that's legally present here that helped them apply? If they have an immigration lawyer, maybe you can connect with their immigration lawyer to help you figure out what's going on with them. We do want to flag that we strongly advise against sending someone to USCIS to figure out their immigration status, especially in the current climate. If you're still unable to figure out by, asking them a series of questions about their status, then we would suggest reaching out to an immigration legal services provider, or if the client has an immigration lawyer, to reach out to that person to figure out, instead of involving the federal government. Slide. So just going over some basics of how the medical assistance program works today, before we dive into the changes coming up. Okay, so MA, medical assistance, Medicaid, these are all different terms that you might hear thrown around when talking about health insurance, public benefits. They're all the same thing. Medicaid is called medical assistance here in Pennsylvania, and the shorthand for that is MA. These are all public health insurance. These all refer to the public health insurance program for low-income people, which is administered by the Department of Human Services here in Pennsylvania. And then on the ground, it is administered by county assistance offices or the welfare office. On the right-hand side here, we just have a list of the MCOs here in Pennsylvania that act as insurance carriers for people on medical assistance. And then on the left-hand side, we have cards that you might see for someone who is receiving state medical assistance. And we'll dive a little bit deeper into what that means, what that distinction is. The next slides. So the medical assistance program has two main buckets for funding. We have federally funded medical assistance, and then we have state-funded medical assistance. Federally funded medical assistance has a number of different programs within that bucket, and goes to people that federal law defines as eligible. It has a higher income limit. However, it has a pretty restrictive immigrant eligibility criteria that is going to become more restrictive due to the changes implemented by HR 1 that we will dive into. Noting that within that bucket is emergency medical assistance, and this is a subset of federal medical assistance that's only available to those who do not otherwise qualify for another category of federal medical assistance. So this includes undocumented people. There is a misconception that EMA is only for undocumented people, and that is not the case. EMA could also be for someone who is lawfully present, but not considered qualified for benefits purposes to get another category of federally funded medical assistance. So, as an example, if someone is an asylum seeker, but not yet approved for asylum, and maybe they just have work authorization, that person may not be able to get federally funded medical assistance. Um, but if they have an emergency health concern, they might be able to get emergency medical assistance. So they're lawfully present here, but otherwise not eligible for another category of federally funded medical assistance, and they're not undocumented. That is a mistake that is sometimes stated by the county assistance office, and just something to flag for yourself. To get EMA, you do have to have an emergency medical condition to be eligible, and EMA is only supposed to provide coverage of treatment of that emergency medical condition that you are approved for. Um, Apart from federally funded medical assistance, we have state funded medical assistance here in Pennsylvania, and that goes to people that state law defines as eligible. Um, it has very low income and asset limits, which we'll review. However, it is less restrictive in which immigrant groups are eligible for receiving it. However, and it still remains unavailable to undocumented people. So for undocumented people, the only option is EMA. Next slide. So this is just a list of some of the federally funded MA programs that I referenced earlier. So at the top, we have some that have a higher income limit, such as home and community-based services, where you receive nursing facility level of care in an institution or in your home. All the way down to the bottom, where we have Magi, medical assistance for adults who are not Medicare eligible and are under 65. This is the expansion population that became newly eligible for medical assistance following the Affordable Care Act in the mid 2000s. As you can see, medical assistance has a wide range of programs and is not just one singular program. It has different financial tests and asset limits depending on the category that a person is looking into. So if someone is being told they're not eligible in one category, you might want to take a look at the Pennsylvania Medical Assistance Handbook to see what other categories that person might be eligible for, or you could consult a legal aid provider like Community Legal Services to see what else might be out there for your client. Next slide. Here we have the programs for the state-funded medical assistance here in Pennsylvania, so significantly smaller pool that also has lower income limits. There's just two programs. There's medically needy only, which is for those age 59 or older, or a parent of a child under 21. And then with an even lower income limit, we have general assistance, medical assistance, which has the same income guidelines as TANF or cash assistance. This is for those who can meet this very low income limit, who are disabled, who are caring for an unrelated child or disabled household member, are in a drug or alcohol rehab program, or are a DV victim. Those latter two having a 9-month lifetime maximum that someone could qualify for that reason for this program. Next slide. So this is just kind of another way to visualize the previous two slides. You can see all the way on the left, we have state medical assistance. That's only 20 to 40% of the federal poverty line, like we discussed. So, very low. And then we have a wide range of those other programs, so, like slowly inching up for what the federal poverty line requirements are, all the way to MAUD, which is the highest income limit there on the right, at 250% of the federal poverty line. It has a pretty generous income disregard and covers those who are working and disabled under age 65. And working is pretty broad. Under MAUD, you could be doing something like watering your neighbor's plants for $5 a week, as long as you could get something from your neighbors stating that they'll pay you to do that. That can count as working for MAUD purposes. The only change in MAUD from other programs is that there is a 5% uh, a 5% of your income premium that you have to pay monthly, but it's otherwise very good coverage. And so could be an option for some people who are otherwise financially ineligible for other categories of medical assistance. And then it has a higher asset limit than other programs at $10,000 in resources, which is, not the best, but relatively generous compared to some other MA programs. Next slide. And then this is just yet another visualization of the different income limits for the different medical assistance programs. This is a really great chart that the AIDS Law Project of Pennsylvania puts out every year. And so it just gives you information about the income guidelines depending on your household size for all of the medical assistance programs. This correlates to the previous slide. If you see the colors around the boxes, they correlate. So for example, if you look at the red box on the previous slide, that was all the way on the left, that correlates to the red box up here in the upper left for GAMA and for the MNO. So you can see in the upper left-hand corner for GAMA, for example, the income limit for a one-person household to be eligible is $205 for one person. It's hard for most people to come under that income limit, but it does take care of some people and will definitely be important to keep in mind with the upcoming changes to the Medicaid program. Next slide. Okay. Now Maripat's going to dive a little bit deeper into immigrant eligibility for medical assistance.
Thanks, Lauren. All right. So with all of that good information that Lauren just went over about the differences between federally funded MA and state funded MA in mind. So keep those distinctions in mind, because what we're going to do next is talk about the different immigration status eligibility criteria that exist for both the federal MA program and the state MA program. They're different, which is why we tried to make it so clear to you about how federal MA is different than state MA. And then once we go through what those rules are today in terms of immigrant eligibility for these medical assistance programs, we're then going to dive into how HR 1 changes those rules and thereby affects both the federal MA program and the state MA program. So let's get into it. We can go to the next slide, please, Taylor. All right. So starting with today, in today's world, as it exists today, before HR 1 takes effect, because HR 1 has not taken effect yet, this first slide starts to tell us about which immigrants meet the federal MA immigration status requirements. So the federal MA programs are the programs with the higher income limits. It's a much bigger program than the state MA program. So in order to get federal MA today, you must have one of these statuses listed on these next couple of slides. We're starting with refugees and people with refugee-like statuses. What do I mean by refugee-like status? Well, it includes people who have been granted asylum, Cuban Haitian entrants, T visa holders who are human trafficking victims, people with withholding of removal, special immigrants from Iraq and Afghanistan, and then people paroled into the US from Afghanistan after the US military withdrawal in July 2021, or from Ukraine after the Russian invasion in February 2022 through parole expiration. So those folks from Afghanistan and Ukraine were paroled. Usually they were granted 2-year parole periods. So some of those parole periods have now expired, but some people were able to get parole extensions. So there might still currently be some folks, those parolees from Afghanistan and Ukraine, who fall into one of these refugee-like statuses and can get federal MA. Next slide, please. In addition to the refugees and the folks with refugee-like status, there are also another group of immigrants who can get, a couple other groups of immigrants who can get federal MA under current rules. First, we have VAWA petitioners. So we heard Lauren explain this status earlier. These are victims of domestic violence. VAWA petitioners and green card holders or lawful permanent residents who have been either VAWA petitioners or green card holders for 5 years, for at least 5 years, 5 years or more in the US. Those folks can get federal MA. VAWA petitioners and green card holders who have had those statuses for less than 5 years might still be eligible for federal MA if they're exempt from the 5-year bar. And we'll talk in a minute about who's exempt from the 5-year bar. And then the last group, which we definitely don't want to forget about, are kids under 21 and pregnant adults through 12 months postpartum who are lawfully present. And that's really important because lawfully present, if you can think back to what Lauren said at the top of the presentation, lawfully present is a very broad term. It includes just about everybody who's here with permission. So even if that permission is temporary, like a tourist visa, for example, those folks are lawfully present. Asylum applicants, a lot of people who have applied for asylum and they're just waiting for a final decision on their asylum application, a lot of those folks are lawfully present. So if you are working with a kid or a pregnant person who's here with permission, here with the knowledge of immigration officials, you're probably working with a lawfully present child or a pregnant person who could get federal MA. Next slide. So a little bit more about the 5-year bar. I mentioned it in the last slide. So some people have to have their immigration status for 5 years before they can be eligible for federal MA. But there are lots of people who are exempt from this 5-year waiting period. Refugees and those folks with the refugee-like statuses are exempt from the 5-year bar. Kids under age 21 and pregnant adults through 12 months postpartum are exempt from the 5-year bar. People who have been continuously present in the US since 1996. We don't see a whole lot of these folks anymore, but every once in a while, somebody pops up. And then some folks in the military or with military experience and their families are exempt from the 5-year bar. So who are we left with? Who is stuck in this 5-year waiting period? For the most part, at least thinking about the clients who we see at CLS, it really comes down to green card holders who got their green cards on a family-based petition. So people who became eligible for their green card because their husband or wife or mom or dad or brother or sister applied for them to immigrate to the US. And that's how they became eligible for their lawful permanent residency. Diversity lottery winners. So these are people who won the immigration lottery. Those folks are subject to the 5-year bar. Once they get here with their green cards, they have to wait 5 years. And then VAWA petitioners. VAWA petitioners, once they become a VAWA petitioner, before they get their green card, they become a VAWA petitioner and they are on this 5-year clock. So they have to wait those 5 years, wait out those 5 years before they can become eligible for federal MA. Next slide, please. All right. So that was a lot of information, which leaves us here. So there are certain groups of immigrants today who cannot get medical assistance just because of what their immigration, they cannot get federal medical assistance just because of what their immigration status is. Those people are green card holders who have had their green cards for less than 5 years and who are not exempt from the 5-year bar, VAWA petitioners who have been VAWA petitioners for less than 5 years and who are not exempt from the 5-year bar, adults who are not pregnant but who are lawfully present, and then, of course, undocumented folks. Every one of these groups of people are going to have an immigration status barrier to accessing federal medical assistance. Next, please, Taylor. So for all of these folks, their only federal MA option is EMA, emergency medical assistance. And we're going to talk in a minute about what emergency medical assistance is, but it's very important to keep in mind because it is having an emergency medical condition is a primary way for these folks to overcome the immigration status barrier that they have when trying to access federal MA. Next, please, Taylor. And then some of these folks, in addition to having EMA as a federal MA option, they also have state MA as an option. I put it in those red letters to remind you, hopefully, of Lauren's slides on state MA and remind you that state MA is wonderful, but it is also pretty tough because the income limits and the resource limits are very low. And so it can be hard for people to get state MA just because of the financial tests involved. But it is still really important to keep in mind for these groups of immigrants who might have no other MA option besides state MA. Next, please. All right. So here's everything I just said kind of on one slide and in one bubble, right? So this is what the law does to us when it comes to immigrant access to medical assistance. It takes, the many, many different ways that people can be in the U.S., non-U.S. citizens can be in the U.S., and it kind of boils it down to these groups of people here on this slide. And it says this is the universe of immigration statuses within which we're thinking when it comes to medical assistance eligibility today. Then the law comes in, and next, Taylor, kind of carves this up into pieces. It says, okay, so these people over here in the green bubble, they're eligible they can get federal MA. Next, please, Taylor. And then it says, but these people can't. Unless they have an emergency medical condition, these people in the gray bubble, they cannot get federal MA. EMA, they can get EMA if they have an emergency medical condition, but if there's no emergency medical condition, they cannot get federal MA. Next, please, Taylor. Then we got state law coming in and saying, but also there's this other option for this group of people within that gray bubble for state MA, right? So these folks here in the red bubble, they can't get regular old federal MA, but they do have these two other options of state MA and EMA. Next, please, Taylor. All right. So that's the world we're living in today with the big green bubble, a kind of similarly sized gray bubble, and then a red bubble inside the gray. Now HR1 comes in. And HR1 changes this whole landscape pretty drastically starting October 1st. HR1 takes this larger group of immigrants who can get federal MA today. So you'll see on this slide, it's about 11 groups of immigrants, 11 different immigration statuses, types of immigration statuses that make people eligible for federal MA today. HR1 shrinks that number of 11 to just 4. So starting October 1st, there will only be 4 immigration statuses that will give people access to federal MA. Those 4 are listed in the box to the right. So we have green card holders who have either had their green cards for 5 years or who are exempt from the 5-year bar, Cuban Haitian entrants, COFA migrants, and then lawfully present kids, pregnant adults through 12 months postpartum. Starting October 1st, those will be the only 4 groups of immigrants who will be eligible for federal MA. Next slide, please. So going back to those bubbles, what HR1 does is it really shifts this landscape. That green bubble that used to be really big, it's now very small. And it's kind of shrunken over to a kind of an egg-sized green bubble over there on the left for just those 4 statuses that we just went over. And we're left with a much bigger gray bubble for folks whose only federal MA option is emergency MA. And the red bubble is also a lot bigger. Taylor, if you could click through 7 times, we can see why that red bubble is so much bigger, because all of these statuses that are flying in now used to be over in the green bubble, but now they are stuck in the gray bubble and in the red bubble, right? So these folks who used to be in the green bubble and used to have today, they have access to federal MA starting October 1st. They will not have access to federal MA anymore, and their only options will be EMA or state MA. Next, please, Taylor. We are paying especially close attention to these folks in the blue circle, because all of those folks in the blue circle could have their green cards, right? So refugees, asylees, special immigrants from Iraq and Afghanistan, T visa holders, and VAWA petitioners, these are all folks who are on a path to a green card, right? So they have a status that makes them eligible for a green card. So they might have a green card. And if they have a green card, then they can scooch back over to the green bubble. The county assistance office might not know that they have a green card if they do have one. And so we are really focused at CLS about getting the county assistance office to do what they have to do to find the people in that blue circle who do have green cards so they're not cut off on October 1st. And then also to spread the word as much as we can to the people in that blue bubble that if they have their green card, they should be letting the county assistance office know about it. I do want on this slide to highlight for everyone that lawfully present kids and pregnant adults are still in the green bubble. I think that is a message that's getting lost a little bit in all the messaging around HR1. The rules are not changing at all for lawfully present kids and pregnant adults. They will remain eligible for federal MA. The kids will remain eligible for CHIP. None of that is changing under HR1. Next, please. All right. So the rules are not changing for CHIP, but they are changing for Penny. So it used to be that folks who were losing access to federal MA might have another health insurance option in Penny, which is Pennsylvania's health insurance marketplace. But unfortunately, that is changing as well. The subsidies that allow people to be able to afford Penny coverage will no longer be accessible to many of the immigrants who currently have access to those subsidies today. Starting January 1st, 2027, the number of immigration statuses that will allow people to access Penny subsidies will shrink to just 3. So it will just be those 3 folks listed, those 3 groups of immigrants listed in the box to the right: green card holders, Cuban, Haitian entrants, and COFA migrants. Those will be the only 3 groups of immigrants who will be able to access Penny subsidies starting January 1st. And as you will see, as I note on this slide, Medicare also will be restricted to just those 3 groups of immigrants starting January 1st. So this HR1 is a really, really drastic shift in terms of immigrant access to not just medical assistance, but all healthcare programs. Next slide, please. So HR1 is a very drastic shift for immigrant access to healthcare programs, but only federal MA, Penny, and Medicare. It does not touch state-funded MA. It can't touch state-funded MA, right? Because state-funded MA is state-created. It exists in state law, not in federal law. And HR1 does not change EMA eligibility at all. So EMA eligibility remains exactly as it has always been under HR 1, and state-funded MA remains exactly as it has always been after HR 1. So starting October 1st, state-funded MA and EMA will become the only options for many people. And so that means that state-funded MA and EMA will become much more important, and much more important for all of you to know and understand as well as you can. So I have a little chart here that just compares these two programs to give you a sense of what they are and what they offer. State-funded MA is a full package of medical assistance benefits that people can use. It's the same package of medical assistance benefits that is available to federal MA recipients. EMA is limited. It is only available to treat the emergency medical condition. State MA has a regular application and renewal process. EMA also has a regular application and renewal process, but on top of that, you must also prove that you have an emergency medical condition. So because there's that extra layer of process with EMA, it can be sometimes more difficult to move through that process and get to an EMA approval. State MA is approved for a full year. EMA is only approved for the duration of the emergency medical condition. So if it's just a short-term emergency medical condition, you might only have EMA for a month or two. If it's a longer-term emergency medical condition, you might have EMA for up to 6 months at a time. Both state MA and EMA are delivered on a fee-for-service basis. People are not enrolled in managed care. Their access card is their health insurance card. State MA has very tough financial tests, which Lauren reviewed earlier. EMA can be sometimes a little easier for people to access because the income limits are higher. There are easier financial tests for people to meet. Next slide, please. All right, so I've mentioned EMA a few times here. You gotta have an emergency medical condition in order to get EMA. This is the definition of emergency medical condition right here. I've highlighted with some color some important parts of this definition. So we'll talk about each one of these colorful parts of this definition in turn. Next click, please, Taylor. So the first is that it has to manifest with acute symptoms. The condition itself, though, does not need to be acute. Just the underlying symptoms. So an underlying chronic or ongoing condition that manifests with acute symptoms can be an emergency medical condition. I like seizure disorders as an example here. Seizure disorders often last an individual's entire lifetime. So that is indeed a chronic ongoing condition, but a seizure disorder manifests with seizures, which are an acute symptom of the seizure disorder. Next slide, please. Acute symptoms may come and go over time. You don't need to currently be experiencing your acute symptom in order to have an emergency medical condition. Next, please. Severe pain is a qualifying symptom. A lot of people have a lot of pain, so that's important to keep in mind. Next. You need to have a need for immediate medical attention, but medical attention is also a broad term, and it can include medicine that you pick up at the pharmacy. So it can include just picking up medicine at the pharmacy and kind of like the whole spectrum of medical services after that. So all the way up to like surgery in the hospital. So think about that broad term and how much could be included in that. Next, please. You need a reasonable expectation of future harm. So this is a future-looking test. You do not currently need to be experiencing the most serious health consequence of your condition in order to have an emergency medical condition. You just need to have a medical provider with a good faith expectation that some serious health consequence will come to you if you don't get medical attention. Next. Last but not least, the expected harm does not need to be death. It can be any serious jeopardy to your health or to your bodily functions or organs or parts, even if that bodily part is not life essential, like an arm or an eye or a leg. Next slide, please. So keeping that definition in mind, we are able to get EMA authorized in Pennsylvania for things like cancer, surgical procedures, dialysis, repair of broken bones, high-risk pregnancies, medications like anti-rejection medications that people need following an organ transplant, anti-seizure medications for seizure disorders, insulin for insulin-dependent diabetes, and others. Next slide, please. All right, so a quick summary. Starting October 1st, federal MA access will be restricted for non-pregnant adults. Only green card holders, Cuban Haitian entrants, and COFA migrants will have access. HR 1 does not change the 5-year bar. The 5-year bar will remain in place. If you're exempt from the 5-year bar today, you will remain exempt from the 5-year bar under HR 1. In addition to restricting access to medical assistance, HR 1 also restricts access to Penny starting January 1. HR 1 makes no changes to federal MA or CHIP access for kids under 21 or pregnant adults. Those rules will stay the same as they are today for those groups. In addition to restricting Penny access, HR 1 also restricts Medicare access, which means that state MA and EMA will become much more important starting October 1 and then again on January 1. So it'll be even more important that we all know and understand those two programs. Next slide. All right. So those are the terrible things that HR 1 is doing to immigrant access to healthcare benefits. The State Department of Human Services has a very big task on their hand right now because they have to make these changes within their medical assistance program before October 1st, which is when HR 1 says that these new rules have to take effect within the medical assistance program. So we're going to share in these next few slides what we know today about the state's plans to make that transition to October 1, and hopefully give you all some useful tips about how you can help your people make this transition too. Next slide, please. All right, so the State Department of Human Services has done some work already on their end to compile lists of federal medical assistance recipients who are not children or pregnant. They've done some work to filter out kids and pregnant people. And then non-US citizens who are not pregnant, not adults, who are adults and not pregnant, and who they did not know to be either a green card holder or a COFA migrant or a Cuban Haitian entrant. They then took that list of people and they sent it all through SAVE, which is the state's database that they can use to check and see if people have green cards. So they sent everybody through SAVE and they found a lot of people with green cards, which is really good news. And they whittled their original list of about 20,000 people down to 8,000 people, which is a big difference. But they are still left with this group of 8,000 people who are currently enrolled in federal MA. They do not know that whether these people have green cards or not. And they are going to send letters to all 8,000 of these people. Starting, we believe, on June 30th, 2026, these letters started to go out. We know a little bit about these 8,000 people. We don't know a whole lot, but we know a little bit. A little more than half of them are in the expansion population, which probably means that a lot of those people in the expansion population probably will have income that's too high for state-funded MA. So these folks I feel like are at the greatest risk of losing MA on October 1st. But about a third of them are elderly, disabled, or parents who may have income low enough to be eligible for state MA. So if we can reach those folks and make sure they understand the state MA program so that they can move into state MA on October 1st, that of course would be really great. Next slide, please. This is the letter that's going out. It asks people to respond by July 30th, but you should know that that is not a hard deadline. If people can't respond by July 30th, nothing will happen to their MA in August. Nobody's MA will be cut off before October 1st. At least that's certainly the way it should happen. Nobody's MA should be cut off before October 1st, and the state is very clear that they understand that nobody's MA should be cut off before October 1st. Next slide. All right, so after those letters go out and the county assistance office starts receiving some responses to those letters, the county assistance office will again review people's cases to see what they've gotten back from people. If people who send their green cards in they'll be able to keep federal MA after October 1st. People who don't respond to the letters, there should be some review to see who can be moved into state MA and who can't. But for everybody who's left at the end of that review process, those folks will get notices to terminate their medical assistance probably around mid-September, with an October 1st cutoff date. Next slide, please. So this last substantive slide that we have here just gives 3 examples of how this could play out. So on the first example we have is Shui, who was granted asylum, but he does not have his green card yet. He's in the expansion category. His income is $1,700 a month. He's going to get that letter that we just looked at, and when he gets it and it asks him to send copies of his green card, he won't be able to respond because he doesn't have a green card. His income is too high for state MA. So Shui is an example of somebody who probably will get a termination notice in September. The state will refer him to Penny, but he will be ineligible for Penny subsidies also starting in January. So he is someone who probably will be without healthcare access because of HR1. He can use community health centers, and he can always reapply for MA in the future if he becomes eligible. In the middle, we have Fatima, who's a refugee. She came to the US as a refugee in 2022, and she has her green card. She's 67 years old. She's in a Healthy Horizons category, which is federal MA. The CAO never asked her for a green card before, and she never had any reason to tell them about it. So the CAO doesn't know that she has a green card. She gets one of those letters that we just looked at. She gets that letter in the mail. It says, please tell us if you have a green card. She says, I have a green card. So she makes a copy of her green card, takes it to the county assistance office, drops it off, gets a receipt for when she drops it off, because that's very important, to protect herself, to make sure that that copy isn't lost. The county assistance office doesn't lose it, finds it, verifies that she is a lawful permanent resident, and she gets to keep her MA on October 1st. The last example is Alejandra, who became a VAWA petitioner in January 2021. She doesn't have a green card yet. She's hoping she might have it next year. Her income is very low, $400 a month. She just lost one of her jobs. And she's a parent. She has a 10-year-old. She is in a TANF-related federal MA category currently. And she doesn't have a green card, right? So the CAO sends her one of those letters that we just looked at. It says to Alejandra, please tell us if you have a green card. She does not have a green card, so she doesn't respond to the letter. But in August, the county assistance office takes a look at her case, sees that her income is low enough for state MA, and she's a parent, so she meets one of the categorical requirements for state MA. So they just move her right over to state MA. She gets a notice in September that says, you're moving to state MA. She's going to lose her managed care, but she'll keep her MA. She'll have fee-for-service medical assistance. Nothing changes for her daughter. Her daughter is 10. She remains eligible in the same exact way that she has always been. So you'll see there are several different ways, right, that this is going to play out for folks. So it'll be important for people to pay attention to that letter when they get it, respond to it if they can, and then follow up to make sure that the county assistance office is making any changes that they should be making. Next slide. All right, appeal now, think later. I'll do this real quick because we only have about a minute, but appeals are always important. It is people, that's like the number one tool that people have to protect themselves against wrongful benefit loss. These appeals are going to become even more important once HR 1's changes start taking effect. There are so many changes that are happening. The county assistance office does not have enough staff to keep up with all the work. Mistakes will happen. Yep. So file appeals. Our motto is appeal now, think later. Even if it turns out there's no merit to an appeal can always be withdrawn and nobody thinks twice about it. But usually there is some reason, some good reason to file an appeal. So get the appeal in. People can come talk to us in Philly if they need help with an appeal, or they can contact their local legal aid program if they're not in Philly and need help with an appeal. Last but not least, Taylor, last slide. Okay, key takeaways, no changes for kids under 21 and pregnant adults through 12 months postpartum, also no changes to CHIP. People with green cards should report this to the CAO, especially if they're a non-pregnant adult, but everybody should let the CAO know that they have a green card. People who do not have a green card, but who can get one, should apply for their green card as soon as they can. For non-pregnant adults who do not meet HR 1's new rules, remember state-funded MA, remember EMA. Those are going to be the two key alternatives for a lot of these folks. For those folks who can't get EMA, can't get state MA, they can still use community health centers, they can still use hospital emergency rooms, they can still use hospital charity care programs. If they have medical assistance now, they should use it now. Get your prescriptions filled, get any medical procedures that you've been waiting to get done, get them done now. Make appointments with your doctors. And when in doubt, appeal. Our very last slide is just some resources that you can click through if you're interested in learning more about this. You can take a look at these links. Whew, just in time with just 1 minute over. Thank you so much, everyone, for joining us today. There probably are questions that we didn't get to. We are going to do our best to answer them and to send out the answers along with the slides and a couple of other pieces of documents and materials for you to use. Thank you for joining.